So maxillary artery, it is a major artery in infratemporal region. It is the larger terminal branch of the external carotid artery. It begins within the parotid gland as terminal branch of external carotid artery at the level of neck of mandible, divided into three parts by lateral pterygoid muscle. The first part runs horizontally forward from neck of mandible up to lower border of the lateral pterygoid muscle. The second part runs upward and forward across lower head of the lateral pterygoid muscle. The third part passes medially through two heads of the lateral pterygoid muscle and enters pterygopalatine fossa through pterygomaxillary fissure. You can see here. So this is the first part, this is the second part, and this is the third part. So you can see here the red colored labeled are the branches of the first part, the green colored labeled are the branches of the second part, and the purple color labeled are the branches of the third part. So let us see the branches of the first part of the maxillary artery. You can see here the anterior tympanic artery, which is passing through the petrotympanic fissure. You can see the deep auricular artery, and you can see the middle meningeal artery, accessory meningeal artery, and the inferior alveolar artery. So there are 5 branches from the first part. So from the second part, you can see there is buccal artery, pterygoid artery, mesenteric artery, and deep temporal arteries. There are 4 branches from the second part. And from the third part, there are 6 branches, namely the artery of pterygoid canal, the pharyngeal artery, the sphenopalatine artery, the greater palatine artery, infraorbital artery, and posterior superior alveolar artery. Same thing. So beginning and termination, so it is the terminal branch of the external carotid artery. So maxillary artery begins as a terminal branch of external carotid artery. So begins at neck of mandible, continues as sphenopalatine artery. So divided into 3 parts by lateral pterygoid muscle. The branches from the first part are deep auricular, anterior tympanic, middle meningeal, accessory meningeal, and inferior alveolar. From the second part, mesenteric, deep temporal, pterygoid, and buccal. From the third part, posterior superior alveolar, infraorbital, greater palatine, pharyngeal artery, artery of pterygoid canal, and the sphenopalatine artery. So if you observe this, the deep auricular artery enters the external acoustic meatus through foramen at its floor. So enters into the external acoustic meatus. Anterior tympanic artery passes through petrotympanic fissure, enters into tympanic cavity. Middle meningeal artery through foramen spinosum, enters middle cranial fossa. Accessory meningeal through foramen ovale, enters middle cranial fossa. Inferior alveolar passes through mandibular foramen, mandibular canal, and branches of the third part, posterior superior alveolar. So foramen and the posterior surface of maxilla, body of the maxilla, then intraorbital, inferior orbital fissure, intraorbital groove or canal, and greater palatine canal to hard palate, the pharyngeal, palatovaginal canal, nasopharynx, artery to pterygoid canal, pterygoid canal, and the pterygoid canal. A sphenopalatine, transmitting foramen as the sphenopalatine foramen, reaches the nasal cavity. So pterygoid plexus of veins, these are the plexus of veins which lie around the lateral pterygoid muscle, drains into maxillary vein, which begins at the posterior end of pterygoid plexus. Even the pharyngeal veins also drains into pterygoid plexus. Communications, so with inferior ophthalmic vein through inferior orbital fissure, with cavernous sinus through emissary vein, with facial vein through deep facial vein. So these connections are very dangerous. Any kind of septic and thrombic emboli will pass into the cavernous sinus. So significance, the contraction of the lateral pterygoid muscle pumps blood from pterygoid plexus of veins into cavernous sinus and maxillary vein. The spread of infection or emboli, infection or thromboemboli coming from facial vein or inferior ophthalmic vein may spread to cavernous sinus through communications with pterygoid venous plexus. Maxillary vein, so it's a short vein, accompanies first part of maxillary artery formation. Veins of the pterygoid venous plexus join at lower border of the lateral pterygoid muscle to form the maxillary vein. Course runs backwards between sphenomandibular ligament and neck of mandible along with first part of maxillary artery. Termination unites with the superficial temporal vein within the substance of parotid gland to form the retromandibular vein. Thank you.